Okay, hello. Have you ever heard of imposter syndrome? Okay. Goodness. Thank you so much for this opportunity to talk today. For those of you who don't know me, I'm Jo Alabaster. I report on the Skeptics Zone sometimes. I do a bit of writing in the Skeptic magazine, occasionally write complaint letters and do a bit of media stuff. I've attended quite a few paranormal expos and mind-body wallet festivals, and while I've enjoyed learning about the paranormal, my main point of interest has been evidence-based medicine and questionable health treatment claims. So a few months ago, when a call for papers was put out for potential speakers here at the convention, which is the theme of good thinking, it crossed my mind I could speak about mental health. And less than 5 seconds later, I was questioning why the heck I've never covered this ground before. Myths surrounding mental health and mental illness are rife, as are spurious treatments and absurd claims. And mental health issues, indirectly or directly, affect most of us here. I don't adhere to a notion of mind-body dualism, and mental health is as much physical as any of the conditions skeptics more often discuss regarding quack treatments: cancer, immunity, and general wellness. Essentially and reductively, mental health is biological. It's about hormones, neurochemistry, neural pathways, and while trouble with mental health primarily manifests cognitively and emotionally, it's affecting us as a whole, physically. Somatic symptoms can arise due to mental health issues. Digestive troubles, headaches, chronic pain can be set off or exacerbated by stress. The ability to care for the body can fall by the wayside, and self-medication through substances that aren't so great for us can take place. And for anyone who's experienced a panic attack, you'll be aware that they certainly manifest as a whole body experience. I'm talking bodily reactions such as raised heart rate, breathing difficulties, tunnel vision, and gastric upset. So mental health also affects us socially. At least 20% of adults are affected by mental illness each year, which means that if you aren't one of them, you're very likely to have people in your family or circle of friends who are living with a mental health condition or two. Current Australian data suggests that at least 45% of Australians will have experienced mental health conditions in their lifetimes, and that's a huge prevalence. So I think that talking about it, getting a few facts straight, and dispelling a few myths is both relevant and incredibly important. At this point, I'd like to let you know that I'm not a qualified expert on the subjects I'll be covering. I'm not a psychiatrist, psychologist, or other mental health professional, a cognitive scientist, or a neuroscientist. Rather, I am a patient advocate. I am very patient given some of the things I've experienced due to myths around mental illness. Ta-da, bad joke, eel. Okay, humour me. No, I've managed to amass a great deal of experience with mental health on a personal level, and occasionally I wonder whether this was part of what compelled me to become involved with scientific skepticism, gaining tools to make sense of the world and processes by which rational and reasoned decisions can be made, and learning ways in which an individual's perceptions and worldview can veer away from what's going on in the outside world at times. We all do this to an extent. Our emotional states and core beliefs colour the way we perceive the world. Likewise, we all experience ups and downs with our mental health. Our moods and perceptions fluctuate. Some of us are prone to depressive or anxious states, and we employ various mechanisms to regulate or challenge emotions or thoughts. Some of us may experience acute phases of unrest with our mental health. Some of us have repeated episodic challenges, and some of us have ongoing chronic states of being mentally unwell. And this is where complex mental illness comes in. So there are a few myths I'd like to discuss around mental health. Some of them might seem a bit absurd to you, which I'm very thankful for. And some of the claims I'm about to make might challenge a few of your positions, which in my books is also a good thing. First up, the archetype of the dangerous and or violent mentally ill person. Okay. It's not just an excuse to show a picture of Christian Bale, honest. Okay, it's a trope used frequently in storytelling. The psycho killer on the loose, the sociopathic murderer, the person who experiences so much trauma that they finally crack in violent and terrifying ways. And this filters into our news media and public consciousness. When a violent crime has been committed, the public understandably wants to know how and why somebody would act out such horrors. Often when details are revealed of mental health issues, that the perpetrator had a history of depression or was on medication, people accept this as an explanation of their actions. Sometimes suggestion of mental illness can be used to distance the violent person from ourselves and the people we relate to. Classing them as the other can be reassuring, as we can then put aside questions of what it would take to push us or our loved ones over the edge and towards violence. The thing is, people experiencing mental illness are very rarely the other. As I've said before, mental health issues are prevalent within our communities, and we're all very likely to know somebody who experiences mental health concerns. This presented correlation between mental illness and violent acts is highly unfortunate because, and I might be stating the obvious here, the vast majority of people living with mental illness do not experience or act out on violent tendencies. In fact, many studies show that people living with mental illness are far more likely to be the victims of violence rather than the perpetrators. Violence is not a symptom of common psychotic illnesses. When violent behaviour does occur, it's likely to be linked to substance abuse, which also applies to people not affected by mental illness, and a history of unrelated violent behaviour, ditto, or improper mental health treatment, which I'll cover later. I've been speaking here about outwardly directed violence. Unfortunately, yes, there are far higher rates of self-harm and suicide among people with mental illness than the general population. Or hopefully, by improving access to best practice treatment and removing social and personally held stigma associated with mental illness, this will reduce in the future. One of the causes of stigma surrounding mental illness is the myth that mentally ill people are a comparative risk to others though, and this simply is not true. Next up, eating disorders. Some people assume that these conditions are the result of high levels of vanity in the sufferer. Eating disorders, anorexia, bulimia, binge eating disorder and other disordered eating, and indeed disordered exercise, are caused and exacerbated by a wide range of factors. Genetic predisposition and personality traits interact with social and environmental triggers, and increased body dissatisfaction can lead to psychological impairment and distress, and physical damage, resulting from disordered eating. And there's the argument against eating disorders being, I'm going to start that line again, hey. And there's the argument against eating disorders being vanity taken too far. Body dissatisfaction is the absolute opposite of excessive pride in one's appearance. That dissatisfaction may not be outwardly displayed, but it's a trigger for disordered eating in many cases and causes great misery. Around 4% of the Australian population experiences disordered eating. It affects all genders, all socioeconomic groups, and all ages. So we can do away with any assumption that eating disorders are the exclusive realm of young middle-class women. In some cases, disordered eating can be entirely unrelated to any desire to measure up to perceived social ideals. It can be a way in which somebody punishes themselves, a desperate attempt to exert control over a facet of one's life, a replay of learned behaviour, a means of self-soothing, all of the above or none of the above. It's complicated, and eating disorders are serious. They have the highest mortality rate of any mental illness. Fortunately, they also have a high success rate with treatment. Writing them off as a teenage girl thing or narcissism is inaccurate though, and does no one any favours. Couldn't find a slide for this one. I like this though. Okay, there's an old line I once heard Doug Mulray use. I'm a schizophrenic and so am I. It's funny, but no. I'm not sure how prevalent it is anymore that people believe that schizophrenia involves split personalities or multiple personality disorder, but it's worth a mention it doesn't. Schizophrenia is characterised by psychotic symptoms. It's confused thinking, delusions, hallucinations, abnormal motor behaviour and or negativity-related symptoms, and it affects around 1 in 100 Australians. What used to be referred to as multiple personality disorder is now part of the category of dissociation disorders, namely dissociative identity disorder, or DID. And there's a lot of debate among mental health professionals regarding DID, which typically involves the coexistence of 2 or more separate personality states within the same person, and often coexists with 1 or more forms of amnesia. Controversy over DID exists regarding diagnostic criteria, the potential that presenting cases are actually cases of factitious disorder or socially transmitted disorders in some cases. Similar to people reading about Morgellons disease and coming to believe that they're experiencing it, it is contended that some people read about and develop symptoms of DID. I don't have any resolutions to present to you on DID, but whatever's going on, presenting cases are undoubtedly cases of serious mental illness. This is tough. Even suggesting that there may be doubt on how genuine a diagnosis is makes me feel like a callous ass and potentially look like one to many people. As with chronic Lyme disease, DID may sometimes be a case of it may not be what you believe it is, but there is genuine suffering and should be taken seriously and handled with compassion. Dissociative disorders do take other forms. You've got amnesia, mental blackouts, and depersonalization disorders, which are characterized by strong feelings of detachment from one's thoughts, feelings, and surroundings. They're often related to trauma and can coexist with post-traumatic stress disorder and complex post-traumatic stress disorder. Okay, here's an important one. The myth that mentally ill people lack strength. This is one that's prevalent in our society and one that unfortunately I've internalized at times when it comes to my own experiences. I suspect many others who live with mental health conditions have done it from time to time too. When I'm having serious battles with my head pigeons, I easily fall into the habit of blaming myself for my condition and my seeming inability to overcome it. If I could just pull myself together, force myself to focus, positively think my way through situations that cause me anxiety, go for a goddamn jog, and ignore the noise inside my head, everything would be peachy keen. Fortunately, I'm quite aware that my perception can be somewhat skewed when I'm not well, and my view of myself as weak isn't realistic. A society tried this sort of attitude with soldiers last century who returned from war with shell shock, now regarded as post-traumatic stress, being the psychological injury incurred after witnessing and or being involved in situations of extreme trauma. The stiff upper lip, don't talk about it and pull yourself together approach didn't work. We had generations of veterans who'd witnessed hell, and some shouldered psychological injuries with little to no professional assistance for decades, and were left coping with PTSD, alcoholism and substance abuse, depression and anxiety, or depersonalization. That's a hell of a strain on a person, and it pains me that veterans ever doubted their strength in the aftermath of what they'd endured. People experiencing mental health conditions fight. They struggle with what's going on inside their heads, manage the best way they can, and sometimes that's incredibly exhausting. Adding self-blame or external judgments regarding how a person came to have mental health problems or how they're dealing with what they're faced with can easily compound the awfulness, and frankly, it's not reasonable nor is it helpful. Sometimes when experiencing poor mental health, simply getting out of bed in the morning can feel like an insurmountable hurdle. It's hard to keep fighting when your own mind seems to be working against you. If we can recognise the internal struggles people face, then we can acknowledge their strength in living with mental illness day in, day out. And this isn't abstract. A few of us, I'm sure, have had some struggles to get here today. And to anyone who has, I'm very glad you made it, and me too. All right, lightening up. Something to look at. I've got an OCD test here. Are you somebody who's bothered by this image? How about this one? Okay, that one really gets me. This. How about that? Not so bad, okay. These are part of one of several BuzzFeed-esque online tests which purport to determine whether you have obsessive-compulsive disorder, or OCD. Problem is they're using OCD as a sort of cultural shorthand for a person who finds a lack of order unsettling, which kind of downplays the real-world experiences of those diagnosed with OCD. Obsessive-compulsive disorder is characterised by recurring thoughts and or behaviour. Strong, persistent, anxious thoughts manifest as obsessions, and compulsions are behaviours to alleviate or neutralise the distressing thought. An example might be that someone's troubled by the thought that they haven't washed their hands recently. This becomes a recurring preoccupation, and they're compelled to wash their hands extensively and repeatedly. OCD can be distressing and incredibly disruptive to daily function and social life. Obsessions and compulsions can take time and in some cases caused injury, an experience far from being kind of bothered by a photo of a disrupted tile pattern. Ooh. Final myth, that mental illness is a modern complaint. This is a bit of a yes and a no. Mental illness has existed as long as humankind has. Indeed, many other animals have been noted to show signs of depression, anxiety, compulsive behaviour, and post-traumatic responses. That said, there's been progression over time. Human experience is always marching forward and evolving, and our social and personal lives have changed just a little bit over the past few centuries. Around the 16th century, which a pedant might classify as modern, our individual existences within societies were for the first time challenged by notions of constructing identity. And with this came a marked increase in the prevalence of mental disease and illness. But being less pedantic, yes, some aspects of our current society and experience can certainly contribute to and exacerbate problems with mental health that are unique to our time. That said, over the last century or so, as with many health conditions across the board, our greater understanding of mental health has led to more widespread recognition and diagnosis of mental health disorders. We've greatly improved treatment options, and we've come a long way. So, if you're experiencing mental illness in Neolithic times, what would your treatment options be? Several Neolithic civilizations believed mental illness to be demonic or spiritual in origin and treated it with trephination, using sharp implements to bore a hole in the skull on the premise that it would let the demons out. Some people did survive early trephination, and there's archaeological evidence of skulls with trephination holes which show healing, but it was brutal. Interesting though, it seems that some Neolithic cultures did manage to establish that there was a connection between the brain and behaviour, so go early us. Ancient Egyptians also made the connection that the brain is the site of mental function, and employed recommendations that afflicted persons engage in recreational social activities to achieve a sense of normalcy. As forward-thinking as this was, they also attributed mental illness to the supernatural and shared the belief that the ancient Greeks held that hysteria in women was caused by a wandering uterus. Their method for the treatment for this particular malady involved fumigation to lure the uterus back into place. So Gwyneth Paltrow isn't really espousing anything new there. They were doing that a long time ago. Didn't work then either, I suspect. Okay. Throughout the Middle Ages, belief in spiritual and demonic origins of mental illness have persisted, though there was a turning point in common belief when Hippocrates asserted that mental illness stemmed from natural occurrences in the human body. His suggestion was within the framework of the four humours, but it was certainly progress. The belief that demons and spirits are behind mental illness didn't disappear though. Exorcisms and rituals are still carried out in an attempt to treat mental illness, and faith healers and psychics also make their share of mental health related claims. Incidentally, okay, I'm sure I'm not alone in having gotten involved in late night discussions as to whether belief in supernatural or paranormal phenomena constitutes delusion, and where mental illness comes into play here. Is it a cultural or subcultural condition, or at an individual level? In fact, I'm willing to bet that a few of us have actually found ourselves wondering what's going on inside the heads of, say, certain Australian anti-vaccination activists. Can I get a water, please? Thank you. Yes. Wondering what's going on in anti-vaxxers' heads and whether a mental health issue is at play. Thank you so much. So naturally we tend to draw conclusions about the people we observe based on their behaviour, especially when that behaviour strikes us as unusual. I think that we ought to be wary, though, of playing armchair psychiatrist. The majority of us aren't qualified to draw conclusions on mental health, and even if we were, we're not in a position to assess someone we might encounter on the internet, on the news, or in the street. Sure, something's up with the way they're behaving is a fair call at times, but I think it's fair to be mindful about throwing around diagnostic terms and specific mental health disorders when discussing third parties, especially when we're not particularly impressed by their behaviour and we're using those labels in a negative way. So socially, people with mental health disorders haven't had it so good. Throughout history, they've faced ostracism, institutional incarceration, and therapies that are downright inhumane by today's standards. Can I check time, please? Ooh, all right, I'm going to do some skipping, I'm sorry. It's very fascinating. We've got Bethlehem Hospital there, asylums, we've got the introduction of talk therapy in the early 1900s. Let's go down here. So, I really wanted to make time to cover a particular style of talk therapy, which was particularly prevalent in the 1990s, which involved patients with generalized mental health troubles presenting to therapists who worked under a particular framework and going through a process where repressed memories of childhood abuse were recovered, be it under hypnosis or via suggestion. I'd like to refer to the work of psychologist Professor Elizabeth Loftus here, who did some groundbreaking research on human memory and showed that false memories can indeed be planted in people's minds. The therapy frameworks that were being used to uncover repressed memories did not take Loftus's work into account, calling into question the veracity of the repressed memory phenomena. All of this created an incredibly difficult situation. The patient believed so thoroughly that they'd experienced extreme child abuse that for all intents and purposes, they were affected as though they had. They experienced trauma, and their relationships with people from the past were reframed through their recovered memories. This in turn held huge social and legal repercussions, which affected and essentially tore apart families and communities, and it does to this day. The fallout from the memory wars, as Loftus refers to them as, has to be handled incredibly delicately. It simply never happened is a very harmful thing to tell a survivor of abuse, and those who underwent forms of therapy which left them with these potentially false recovered memories would likely be harmed in a similar way by that denial. As with survivors of childhood trauma and abuse, people who underwent repressed memory therapy are carrying around great psychological injuries and need to be treated with care. And it's essential that therapists of any form need to be aware of the power of suggestion. Let's go lighter now. Look at that. I've got some internet memes for you. Okay, posts that fly around on social media. You might have seen this charmer from somebody who thinks that a walk in the woods is going to cure depression and quite possibly believes that there's an evil farmer beast out there who poos out pills. There's another one. Same kind of deal. Okay, the internet being what it is, a few people have offered up some corrections. This is direct and to the point. This one certainly has some truth to it. And this one acknowledges that some people do find that getting out and spending time in natural surroundings lifts their mood somewhat. And some people can include people who live with depressive illnesses. Getting out of the house, getting some physical activity, and spending time in calm and peaceful environments can be incredibly helpful activities in the management of mood disorders, depression, and anxiety. Exercise in particular is recommended and utilised by many people with mental health issues. Frankly, though, it doesn't work for everyone, and it's not appropriate in all instances to suggest that all somebody needs is some goddamn sun and trees and shit. The bigger problem with these images, though, is that they aim to demonise medication, another means by which to manage mental health issues, and an integral one for many people, giving them greater ability to function, think clearly, regulate emotions, and live the best possible life. To attempt to discredit that, which is literally a life-saving treatment for many people living with mental illness, is up there with claiming that vaccines and chemotherapy are bullshit. And I can only hope that these dangerous sentiments don't continue to travel too far. Yeah, unsurprisingly, the usual suspects who claim to be able to replace vaccination or cure chronic disease also believe that they have the answers to mental illness. Yeah, homeopathy for mental illness. Let homeopathy calm you down. And we've got superfoods too, of course. And we've got people who claim psychiatric medication causes people to go on killing sprees, and people who claim that psychiatric medicine is mind control, and a certain very wealthy religious cult who won't allow their flock to access treatment for psychiatric illnesses. Okay, so psychiatry is not a perfect discipline in its current state. There is no one-size-fits-all treatment, no panacea, no guarantee that any given form of therapy or treatment will be effective for an individual. If medication is a treatment option, it can take some trial and error to find the right drug or combination of drugs at the right dose, and even effective medication regimes can come with unwanted side effects. Not every therapist is a good match for every patient. Rapport is incredibly important when embarking on talk therapies, and attempting to work with a therapist who's a mismatch can be very disheartening. Treatment may offer management tools for living with a mental health condition rather than a cure. It might well be a lot of time and effort and energy. And as such, I can understand why people can be drawn to alternative and unorthodox treatments and therapies, especially when they come with the suggestion of a cure, a lack of side effects, or a promise that it's all going to be simple. The most effective treatments we currently have still kind of suck, and that's not an easy thing to come to terms with. On balance, they can also improve quality of life greatly, and that certainly beats the alternative. As with any health concern, a person's first stop should be their GP, who's in the best position to make a preliminary assessment, give recommendations, make referrals for further assessment and treatment when required. This can be a confronting step for many people. All I can do is reassure you that GPs are there to help in a non-judgmental manner, and that, as with any health issue, if you're experiencing distress or a loss of function due to mental health concerns, ignoring it and hoping it goes away may not be your best bet. Get it sorted. Resources on some of the topics I've covered today are available through some of Australia's mental health organisations, such as the Black Dog Institute, who specialise in mood disorders, Beyond Blue, who cover depression and anxiety, and the Butterfly Foundation, who focus on eating disorders and body image issues. And I have very much gone over time. I apologise. Thank you so much for listening.
Thank you, Jo. That was great.